Hi, my name is Dr. Tugbiyele, and I am a board-certified fellowship-trained urogynecologist in Metro Atlanta and top doctor in urogynecology. I've cared for thousands of women like you with pelvic floor conditions for over 21 years. In addition to being a urogynecologist, I am a husband of 21 years, happily married to my wonderful wife, and a father to 3 wonderful children, late teens and 20s. And I also have a dog. His name is Cooper. He's the joy of our family and keeps us laughing all the time. A mini golden doodle. We love him. Growing up, I really was inspired to go into medicine because my father was a pharmacist. He worked as a pharmacist both in Nigeria, Lagos, Nigeria, as well as in the United States. And while I loved how he took care of people. A pharmacist almost serves like a person's doctor. They're not their doctor, but a lot of people come to a pharmacist to seek care and also to get medicine for their health. And so I kind of got a chance to see how it is to take care of women with different conditions. However, I wanted to be more of a physician who took care of people, not just administering medicine, obviously. And so I was inspired initially by my dad growing up in Nigeria, and then coming back to the United States, I loved the sciences, I loved anatomy, I loved ultimately surgery when I became a resident and in training. And when I pursued my residency training in obstetrics and gynecology, I decided to specialize in pelvic floor reconstruction and urogynecology to serve women specifically who have issues with their pelvic floor. So when patients come and see me in the office, I want to make sure that you feel heard, understood, that you come into a welcoming environment where you're listened to and cared for with compassion and with dignity. And also that once we talk about the options, that you feel educated. When you leave, you'll feel like you've been heard, understood, and you've been educated. You understand exactly what's going on with your body and how best to move forward at a solution. When women come and see me, I always say no one wakes up in the morning and says, oh, I want to go see a urogynecologist, right? And so women who are coming to see me for urogynecology have issues, whether it's prolapse, bladder leakage, pelvic pain, recurrent bladder infections. So there are different things that cause women to come and see me. So initially when I walk into the room, I introduce myself, I reassure my patients that I've been doing this for a long time. I've cared for thousands of women like you. However, they're a good, safe, and effective solution to improve your quality of life. And you can trust that when I listen, we'll arrive at a solution together, and don't be embarrassed by it. The hardest part is telling me how you feel, and I'll listen, and we'll together arrive at a solution that will improve your quality of life. For women who feel embarrassed or hesitant to seek help for pelvic floor disorders, my plea to you is you don't have to feel embarrassed. You don't have to live or put up with this. A lot of women don't want to talk about this. You're not the only one. This is quite common. However, you don't have to live with it. The sooner you have this addressed, the better it'll be before things get worse. And so don't let fear or embarrassment keep you from seeking the help that you need, because you're worth it. Your quality of life is worth it. So seek help. And that's the hardest part. Talking about it is the hardest part. And once you've gotten over that, then we can get to a road to solution. So if you've been suffering quietly with any condition of your pelvic floor, it may be painful intercourse, it may be bladder leakage, it may be leakage with activities or exercise, or pain or recurrent bladder infections. You don't have to live or put up with these conditions. They are quite common. Up to 50% of women can have any one of these conditions, so you are not alone. They're good solutions, options that are safe and effective. And so once we talk about it, we'll be able to arrive at a solution that will improve your quality of life, your comfort, your confidence, and control. And then you'll be able to live again. You'll be able to do the things you enjoy again. Imagine how you feel when you can travel and see your family without fear of leakage, or not having to stop exercising and doing the things you enjoy because of prolapse or leakage. Imagine how it will feel to be able to go out and do things with friends because you don't have to hold back because of the pelvic floor. All of this is possible for you when you work with me, so I invite you to work with me to improve your quality of life. Usually my day starts with a time of prayer and devotion. Why? Because I'm going to go out and take care of women. I want to be at my best, listening, attentive, compassionate, attentive to detail. And so for me, being grounded in my faith and being grounded in spending time with God, reading my Bible and praying is very, very important to me. And that starts my day off right and starts my mind off right. And after my short commute, once I get into the office, I check in with my team, a quick huddle, and then start seeing patients. And from the time I walk into the room, it's with a smile, smile, a firm handshake, great eye contact. I want women to know that I'm listening, attentive. I pay attention to the details of what brings them in, and also pay attention to, because every woman's not the same. So this is not a cookie cutter approach. And after a physical exam, then we talk about solutions. And I always say I lay out all the solutions on the table because I want women to understand fully what their health condition is and what their options are. And then I give, of course, my recommendation, and then we arrive at a solution together. And so starting my day starts with, of course, having my mind right, my heart right, and then being able to come to the office, serve my patients well. On a day I'm in the operating room, my day starts similarly, where of course I start my day with my time of devotion, spending time in the Bible, prayer. My faith is very, very important to me. It dictates how I take care of people. Why? Because I believe that I am a servant. I'm really serving God and taking care of women. And so I want to do it to the best of my ability. So when I start my day with prayer and devotion and in my Bible, it's because I want to be in the right frame of mind to take care of women. And I want to also do it with excellence, because that speaks well of my faith, that speaks well of me working well for God, and taking care of my patients with excellence is very, very important. So I want to do a good job, take care of women. Why? Because women, I'm talking to, whether it's a wife, a mother, a sister, a daughter, a friend, and with lives and goals and aspirations, and that's important to her and it's important to me. And so I want to really do that and do a good job and serve people and serve God well. And then I prepare to go to the operating room. I meet patients in the preoperative area. We talk about the plan for surgery, make sure all your questions are answered, and then perform the surgery. And I stay clear of all distractions. I really go in almost like an athlete, just very focused on being able to take care of and execute on the surgery with precision and with focus. To work with me, one way to reach me is through my office number, which is 770-292-4200, or you can go to my website, drtugbiyele.com, and there's an inquiry form there that you can complete, and that will get to my team, and they'll call you to schedule an appointment to see me. My office is located on the Northside Forsyth campus. Office address is 1100 Northside Forsyth Drive, Suite 410 in Cumming, Georgia.